So we will be talking about a nursing theory created by Jean Watson, known as the science of human caring. So who is Jean Watson? She is a nurse theorist who focuses on the science of human caring. She's known for her work in developing, maintaining, and exemplifying patient-centered care. Jean Watson received her Bachelor of Science in Nursing from the University of Colorado in 1964. She then earned her PhD in educational psychology, also from the University of Colorado. Beyond that, she has 10 honorary doctoral degrees in her name for her extensive experience working in mental health and nursing and caring science. Throughout her career, she created this theory that we are talking about, the theory of human caring. She did that between the years of 1975 and 1979, with the desire to distinguish nursing science as separate from other healthcare professions. She has since written more than 20 books on her teachings. Watson was a distinguished professor at the University of Colorado Anschutz Medical Campus, where she also held the first endowed chair in caring science. She was president of the National League for Caring and founding member of the International Association in Human Caring and the International CARTIAS Consortium. She is the founder and current director of the Watson Caring Science Institute. So the core concepts of Watson's theory is that nursing as a practice should be one of equanimity and be done with a deep loving kindness for one's patient and, just as importantly, for oneself. This can be achieved by being truly present with patients and colleagues and by cultivating one's own spiritual practice. The core concepts include a relational caring for self and others, meaning a strong love for both self and others. This can be achieved by creating a solid foundation that morally, ethically, and philosophically embodies love. There are multiple ways to cultivate one's own caring science: through studying science, art, listening to one's own tuition, and through ethical, cultural, personal, and spiritual exploration. Formation of transpersonal caring relationships is the next core concept. This concept is embodied by doing things such as heart-centered healing or caring, having an authentic presence, maintaining inner harmony, and practicing caring consciousness. All these phrases Watson has coined to mean that in order to embody the science of caring, a nurse must go beyond ego to a more spiritual caring. A nurse must make a moral commitment to protect and enhance dignity and truly respect or love a person as well as the self, and then honor the needs of others the way you would honor your own needs. A nurse must also practice and honor wholeness of mind, body, and spirit in self and in the other. The next core concept is caring occasions or caring moments. These are heart-centered encounters with another person. It is when two people with different backgrounds come together and share a human experience that is meaningful, authentic, intentional, and that expands each person's worldview and spirit so that each discover something new about themselves and new life possibilities. Something essential to the core concepts of this theory is that there are multiple ways of knowing and cultivating loving kindness for the self and others. And this can be done through studying science and art, and also through ethical, intuitive, personal, cultural, and spiritual endeavors. The next core concept is that this theory must take a reflective, meditative approach. So understanding one's own role in human caring through this reflective or meditative approach. This means increasing consciousness and presence to the humanism of the self and the other. By doing so, by being reflective, we can better determine who we want to be as nurses and the impacts we want to make for ourselves, our organizations, and our patients. The next core concept is that caring is inclusive, circular, and expansive. It starts with the self, then it expands to others, then to the environment and nature, and then to the universe. As deep, pure caring expands, it changes the individual and then the other and the environment through these caring occasions or caring moments, as discussed above. It ultimately changes the person's worldview for the better. So lastly, are Watson's 10 curative factors, redefined as the Caritas processes. These are comprised of 10 guidelines meant to help nurses put love or heart-centered caring practice into action. While we won't read through each here, the takeaway to note is the ideals of compassion, caring, healing, authenticity, wisdom, and love. We've included a full list of guidelines in the additional resources section of this presentation. So, Watson's theory in relation to the nursing paradigm, person. Watson believes that in order for a person to be considered fully healed, only the total healing of mind, body, and soul could accomplish this. She views the person as the recipient of care, and that this person includes their spirituality, culture, family, friends, and their socioeconomic status. Watson's theory of human caring aims to satisfy the person meta paradigm by acknowledging that each individual has their own unique set of needs. She feels it is essential that nurses accept and validate a person's needs regardless of their wish, of their customs and beliefs, as these define the person. She also feels that in order for a person to be fully healed, a holistic approach, which focuses on mind, body, and soul, is imperative. Each individual patient needs to be valued and understood, with the nurse always being authentically present. Additionally, each patient deserves the right to have their dignity and privacy maintained and protected at all times. So, Watson's theory in relation to the nursing meta paradigm, health. The meta paradigm of health refers to the quality and wellness of a patient as defined by each individual person. For Watson, the meta paradigm of health means that the act of curing refers to more than just healing of an illness, but also includes mental and spiritual healing. She ties in many of her beliefs from the person meta paradigm and integrates them into her definition of the health meta paradigm. Watson believes that although curing is part of the process of achieving health, it is much more than a physiological response. In order for health to be achieved, nurses must take a holistic approach with patients, one which is structured around a complete balance of mind, body, and soul. She states that in order for healing to be effective, there needs to be a complete balance of a patient's physical, cognitive, and spiritual health, which ties closely back to her definitions in the person meta paradigm. Watson also identifies another important aspect of health as the nursing assessment. It is crucial to assess patients based on their individual needs in order to maintain optimal health. Patients in acute health care settings, for example, may require multiple assessments daily, whereas patients in other areas of the nursing field may require less observation. Watson states that illness prevention is a crucial part of total health as well. Encouraging nurses to consider the whole picture and long-term goals when working with patients is crucial. She also believes health should be addressed on a day-to-day basis. This is due to the fact that the health of a patient can change drastically in a short amount of time between one moment and the next. Watson's theory in relation to the nursing paradigm, environment. According to Watson, the patient's environment affects their ability to heal. While caring for a patient, it has been proven beneficial to the health of the patient to establish a home-like environment. Providing a sufficient level of privacy allows the patient to feel more safe and comfortable. Noise levels should also be kept at a minimum. As a result, patients are more likely to feel calm and relaxed. Proper lighting and access to nature instill an uplifting feeling and reduce stress and anxiety. This can be achieved by opening windows or taking your patient outside if possible. Watson's theory in relation to the nursing paradigm, nursing. Watson suggests that establishing meaningful relationships leads to patients feeling more comfortable and safe. A strengthened bond can also lead nurses to gain more patient information, which helps to promote better healing. While science and medicine are important, therapeutic components such as focusing on the patient as a whole and treating their mental and spiritual needs are equally important. Watson stresses the need for nurses to educate their patients. Nurses should be leaders who are able to teach patients to take ownership of their well-being and promote better health. So Watson's theory application to nursing. The element of caring is a fundamental practice for nursing for both the nurse and the patient. Nurses must first take care of themselves in order to care for patients and be present during every interaction. Self-care will look different for each person, but some examples of simple practices for busy nurses include exercise, ensuring adequate time off from work, planning time to be with friends or family, specific stress reduction techniques such as meditation, performing a self-assessment for a nurse's individual morals and beliefs allow the nurse to establish a set of values that can be used to empathize and care for patients. Additionally, as nurses, it is important to recognize each patient as a unique person and not just simply as a patient. For this reason, nurses should conduct individualized nursing assessments to evaluate for every person's unique needs and wants for the mind, body, and spirit. This allows the nurse to build connections and spend less time guessing what the patient needs or wants. Examples of how to address health of the mind include caring moments, which is taking time to have uninterrupted moments with every patient. And this can promote conversation between the nurse and the person or the patient to discuss both positive and negative emotions surrounding their care. We can also explain the daily plan to the patient and family and friends, and include the patient in planning long-term goals to make them feel equally involved in their own care. For the body, nurses serve as a patient advocate. This means ensuring that a patient's physical needs are taken care of, such as advocating for pain medication if the person is experiencing pain, is an example. The nurse can independently control the environment for the patient that may promote healing, such as opening the curtains for more natural light or by clustering care to allow for rest. That is something the nurse can do within her scope of practice. For the spirit, nurses can cultivate caring relationships by including all social supports in care, such as family or friends. This can help strengthen relationships for the patient that may be lost during an illness. Additionally, it is important for nurses to foster culturally appropriate relationships to help establish trust with the patient. This means understanding the cultural norms for touch, eye contact, and ways in which the culture expresses respect. Nurses can offer appropriate spiritual service as well, such as pastoral visits during inpatient stays. So these are the Watson's 10 curative factors that we talked about during the core concepts. And they just kind of outline that deep loving kindness that you cultivate spiritually and culturally for the self and for the patient. This is the website for the Watson Caring Science Institute. There is a wealth of information on this website if you care to take a look at it. And if you click on, you can click on this link to look at it. And that is Jean Watson's Science of Human Caring.